Are you having trouble sleeping due to intrusive thoughts? In this video, we share the keys to defeating these persistent mental invaders and provide doable techniques for taking back mental authority and achieving inner calm. Have you ever wondered why, despite your best attempts to ignore them, these ideas always manage to linger, or how to take back control and stop the worry they cause? Come along as we solve the puzzles around intrusive thoughts and offer doable fixes to help you escape their hold. Are you prepared to regain control of your mental health? Now let's get started. Catastrophic thoughts. Fear of the worst-case scenario. Fears of danger or calamity looming overwhelm the imagination, causing one to exaggerate the worst-case situation to an absurd degree. These ideas can take many different shapes. They can be visions of personal failure or disaster, or they can be images of loved ones going through a tragic event. It's important to recognize catastrophic thoughts when they arise without adding to their intensity. Start by challenging the veracity of these beliefs. What evidence lends credence to these concerns, and what evidence disproves them? It can be helpful to reduce the impact of such severe possibilities by providing a more balanced viewpoint and rationalizing their possibility. Next, use grounding exercises to bring yourself back to the present and break the negative thought pattern. To relax your nervous system, engage in deep breathing exercises where you concentrate on the feeling of each breath in and out. Take up mindfulness exercises like taking in your environment or cultivating gratitude to help you turn your attention from distracting ideas to the here and now. You can lessen the power these catastrophic thoughts have on you by focusing your attention on the present moment. Furthermore, examine other possible readings of the events to refute the disastrous narrative. Think about more realistic and balanced viewpoints that respect your resilience and capacity to overcome misfortune while yet acknowledging the uncertainties of the future. Think back to instances in the past where you overcame difficult circumstances by using your ingenuity and perseverance as a source of strength. Regaining control over your ideas and emotions can be achieved by rephrasing catastrophic notions as inflated possibilities instead than inescapable occurrences. Finally, if catastrophic thoughts keep coming back to you and are interfering with your day-to-day activities, get help from dependable family members or mental health specialists. Speaking with others about your concerns and fears can help you feel less alone and overwhelmed by offering perspective, validation, and assurance. In order to discover the underlying causes of catastrophic thinking and acquire useful coping mechanisms catered to your particular requirements, you should also think about attending therapy or counseling. Remind yourself that you are not struggling alone, and that support is there to aid you on your path to resilience and mental serenity. Obsessive thoughts. Endless loop of repetitive concerns. Persistent and recurrent in character, obsessive thoughts frequently center around particular topics or problems that predominate in the mind. These ideas can include reservations about safety, apprehensions about contamination, or issues with symmetry and order. Recognizing the cyclical nature of obsessive thoughts and the want to interact with them, which merely helps to perpetuate their presence, is crucial when confronted with them. Cognitive behavioral therapy is a useful method for treating obsessive thoughts since it assists patients in questioning the validity and significance of these ideas. Thought-stopping exercises can break the pattern of compulsive thinking and rumination that goes along with obsessive thoughts. This entails deliberately refocusing attention to a neutral or constructive focus and noticing when obsessive thoughts start to surface. Exercises that require critical thinking might also assist people in recognizing and disputing the illogical assumptions that underlie their compulsive thoughts. Those who challenge the data underlying their views and take into account different viewpoints can progressively loosen the hold that compulsive thought patterns have over them. Using distraction methods is another effective way to control compulsive thoughts. Redirecting the mind from obsessive thoughts to more productive undertakings can be achieved by partaking in activities that demand focused attention or physical exertion, such as exercise, hobbies, or artistic endeavors. In a similar vein, engaging in mindfulness exercises can assist people in developing present-moment awareness, which enables them to watch their thoughts without becoming caught up in them. In the midst of the chaos of compulsive thinking, people can make room for more clarity and inner serenity by developing a non-judgmental attitude toward their thoughts and experiences. Lastly, those who are experiencing obsessive thoughts may find great help and support by reaching out to mental health specialists or joining support groups. Through controlled and gradual confrontation, therapy approaches like exposure and response prevention can help people gradually lessen the potency of obsessive thoughts. Furthermore, making connections with people who have gone through comparable things can provide understanding, empathy, and validation, which helps lessen feelings of shame and loneliness. People can learn to control and eventually break free from the hold of obsessive thoughts, taking back mental autonomy and experiencing more peace and freedom in their lives, provided they are persistent and receive the appropriate help. Intrusive images, unwanted and disturbing. Mental imagery, vibrant and upsetting mental images that invade consciousness are known as intrusive images, and they can cause severe discomfort and worry. The unifying characteristic of these visions is that they are obtrusive and unwelcome, regardless of whether they are ordinary, erotic, violent, or otherwise senseless. When confronted with intrusive pictures, people may experience overwhelming feelings of humiliation or helplessness in managing their thoughts. Nonetheless, there are methods and approaches that people can use to effectively control and cope with intrusive visions. First and foremost, it's critical to recognize that intrusive pictures are a typical occurrence and do not accurately represent an individual's genuine intents or objectives. These pictures don't define who you are as a person. Rather, they are frequently the result of the brain's innate propensity to produce erratic or upsetting ideas. Knowing this can help people tackle the issue with more compassion and self-acceptance by lowering the guilt and self-blame connected to intrusive imagery. Second, people can learn to put some distance between themselves and the invasive pictures by engaging in acceptance and dispersion practices. People can learn to recognize the picture's presence without reacting to them, as opposed to attempting to repress or push them away, which frequently results in greater anxiety and rumination. People can become more aloof and tolerant of their intrusive imagery by practicing mindfulness practices, such as accepting thoughts as they emerge and not passing judgment on them. Thirdly, people can lessen the distress brought on by intrusive pictures by partaking in activities that encourage relaxation and calm the nervous system. Engaging in practices like progressive muscle relaxation, meditation, or going outside can assist people in controlling their emotions and lessening the severity of intrusive imagery. By making self-care a priority and partaking in activities that foster calm and well-being, people can strengthen their resilience and improve their capacity to deal with intrusive thoughts. In addition, getting help from support groups or mental health specialists can give people direction, affirmation, and encouragement while they work through their experiences with intrusive images. Cognitive behavioral therapy and exposure therapy are two therapeutic methods that can assist people in facing their concerns and creating coping mechanisms to better control intrusive visions. Furthermore, making connections with people who have gone through comparable things can provide understanding, empathy, and validation, which helps lessen feelings of shame and loneliness. Individuals can regain control over their thoughts and experience more peace and freedom in their life by learning how to manage and cope with intrusive images with the correct help and coping mechanisms. Whether they take the form of terrifying visions, compulsive worries, or intrusive thoughts, managing intrusive thoughts is a difficult process that calls for perseverance, fortitude, and support. Remember that these thoughts do not determine who you are as a person, even if they may feel overwhelming and unstoppable at times. Over time, people can learn to control and lessen the impact of intrusive thoughts by putting into practice effective coping mechanisms like self-care routines, mindfulness, and cognitive behavioral therapy. Furthermore, getting help from dependable family members or mental health specialists can be very beneficial in terms of direction, affirmation, and motivation throughout the journey. Therapies including exposure therapy, cognitive behavioral therapy, and support groups provide specialized methods for dealing with particular kinds of intrusive thoughts and creating individual coping mechanisms. In addition, managing the difficulties caused by intrusive thoughts requires developing a loving and accepting attitude toward oneself. People can learn self-compassion and accept that intrusive thoughts are a normal and typical part of the human experience, instead of punishing or condemning themselves for having them. People can lessen the guilt and self-judgment connected to intrusive thoughts by being kind and sympathetic to themselves. This promotes resilience and a sense of empowerment. Even though intrusive thoughts might never totally go away, people can learn to deal with them and take back mental control. People can effectively manage the intricacies of intrusive thoughts and achieve a higher level of acceptance, freedom, and peace in their life. By adopting helpful coping mechanisms, getting help when necessary, and practicing self-compassion. Remind yourself that you are not alone in your struggles and that you may get assistance and hope to aid you on your path to resilience and mental health. Ready to conquer intrusive thoughts and reclaim control over your mind? Subscribe now to unlock expert strategies, practical tips, and empowering insights to navigate the complexities of intrusive thoughts with confidence and resilience.